Start streaming.
We'll ask Hannah to chat.
I can pull it up on my phone.
Oh yeah, you can do it by yourself.
So is it going?
Did you hit the?
Oh, there we go. It should be because I put the chat there. Let's see. Yeah.
Oh, it's
going.
delayed one is coming
Yeah.
out. Nobody.
Just barely start.
Good morning. Please send chat.
I put a little thing in the. If you have
Yeah.
any questions, you can go to the chat bar. We'll be watching it.
Very good. Okay. Today we're gonna test your knowledge on all the MSK ultrasound. Okay. Now Jeremy, you're gonna do upper limb. Oh, leg first, right?
Oh, I thought we were doing leg.
We said we were going to.
Yeah, we're gonna do leg, but
Yeah,
today is the last day of the year.
Yeah, I
So-
I don't have a tank top. Like,
No, you don't need to go to tank top.
yeah.
I'm gonna do no tank top part.
No tank top.
No, you guys gonna just continue to explain. Okay, let's go from the. Jeremy is gonna do whole from the hip to leg. Yeah, let's do it. Just the cover or whatever. I don't know what that
I
is.
appreciate what the.
What's that?
It's like a bag or something.
Okay, Jeremy.
I can,
Oh, yeah, that's the
I
pillowcase.
can put my
Oh,
my
that's
like even.
oh, pillow
Okay.
cover.
It's
Pillow
not gonna-
cover. What? I didn't know what that is. Okay, so Jeremy, you're teaching. Is this okay? Comfortable?
Bring the pad up a little
Yeah,
bit,
I
just
will
so
do
I can
that.
see the option.
Yeah.
That always was good, right?
Yeah, this is good, right? Yeah, okay.
You want to do
One is you.
Yeah, are we starting from
You.
all the way up?
Yeah.
from here?
So you explain
So
to
I'm
us.
gonna go up and down.
You
Okay.
explain to us what you are watching.
Okay, so today we're gonna do the lower extremity. We're gonna start most.
You gave me the bag. I put the leg in the bag.
You're my pillow today.
Alright.
This
here
is
we go.
not an air test. Alright.
You can go.
We're gonna start with the lower extremity going proximally to distally.
Okay, let's start.
Awesome.
So show me the iliopsoas and then tensor fasciae lata, lateral femoral cutaneous nerve.
Ooh,
Here.
see.
So palpate the IIS. I'll go.
I read that.
Oh. Okay, very lightly. Just to where AIS is. Where this femoris is going to attach. If I go more superiorly, I get to the IS, which is now right in the middle of the screen.
Okay.
If I go more medially, across here,
This
We're
is
gonna
the
go to-
abdominal muscle.
to our abdominal muscle over here.
We go too far. Okay, we're gonna scan down.
Yep, ASIS and down.
So when you scan down, you're going to laterally, right?
So this is laterally,
Yeah.
which is getting towards the TFL.
Continue. Or you
Yeah,
wanna go
laterally,
laterally?
that's going to be TFL.
TFL and the gluteus medius. So scan
TFL and
down.
gluteus medius.
So you cannot see tensor fasciae lata yet because the starting
Oh.
origin is ASIS, right? So if you
AS
have to-
or AR?
Yeah.
Oh.
AIS, I'm sorry. So
Okay.
you have to come down slowly and then you start to
Yeah.
see tensor fasciae lata.
Yes,
Okay.
that was blue. Or maybe.
Yeah, that has nothing to do with this. This is coming off the iliac crest.
Okay.
So ASIS
And
going
scan
inferiorly.
down.
And
Where's the ASIS? You're. Yeah.
ASIS.
Okay.
Come on, go down.
Okay. first
There's my
reverse
iliac.
triangle. Slow down. Stand down. Okay. This is the tensor fasciolatum. You want to see tensor fasciolatum. You go medially.
Is it the depth? Could you please look?
I did everything.
Thank you,
You
Dr.
guys great. So here, this is the tensor fasciolatum, right?
Mhm.
This is the sartorius.
Mhm.
And this pocket here, in
Rectus.
between TFL, sartorius, this pocket is the lateral
Rectus.
femoral cutaneous
Tendon,
nerve.
yeah.
Lateral femoral cutaneous nerve sits there. As you come down, you remember, from the ASIS, about 5 centimeters down, you can see the lateral femoral cutaneous nerve on the sartorius.
Oh yeah, and that's
Yeah.
the circular.
So it's
Yeah.
going to be around the pocket, and then later it goes on here, on the top. So I'm going to change the depth for you guys. I think you have to put a lot of gel because I know it's not clear.
You saw how much gel they put on for your OB exam, right? They just,
Yeah,
They're
they're
very
not shy.
generous, very
Not shy
generous.
about it.
Yeah.
Yeah.
So ASIS again, and then coming inferiorly and medially to the AIS.
Okay, continue.
Yeah.
So slightly hip abduction flexion. That's the best way you can see. The shapes become different, right? Much clear?
Okay, now it's femoral head already down there, right? I just saw it.
There we go. Well, now all four muscles are in view, right?
Okay, so what foremost are you talking about?
TFL laterally, sartorius medially.
When you say
rectus.
foremost in the iliopsoas, it's more sartorius, iliopsoas, rectus femoris,
Yeah,
right?
yeah.
Okay.
Inferiorly is rectus femoris, and contract your knee. Straighten your knee.
So
or put your
instead,
knee down.
yeah, you can do
so
that, or
rectus
so you can
femoris.
scan down and it gets bigger,
Yeah.
right?
Yeah.
Scan up, it gets smaller,
Yeah.
and then you have to go medial side, that's the iliopsoas. You didn't show iliopsoas. See femoral head. You can
There it
see
is.
artery over there, you have to go femoral artery over there. Let me put the, you can see
Yeah,
femoral
yeah,
artery
yeah.
over there,
Yeah.
right? Always your home base is what?
The triangle. Artery.
Triangle, but the femoral artery you have to look for it, right?
Yeah. Oh, I wasn't medial enough, that's why.
Yeah. So what I don't understand, you keep like staying in the outside of the. So this is the femoral artery, right?
Mm-hmm.
This is the femoral artery, and then this is the femoral nerve. Femoral nerve is in the different sheath. Femoral sheath has femoral nerve, the artery and vein, but nerve is in the separate sheath. So you can do femoral nerve block. When you do that, you only go to this area. You can actually block femoral artery here. It's different sheath, so you don't need to touch the artery and vein. Okay, and then fourth femoral artery is supplying the lower limb. And here, you're gonna go back again. Okay.
So the muscle on the right below is iliac, right? And soleus is more kind of medially
So
below
psoas
the.
is here.
Yeah, yeah.
It's the psoas.
Mhm.
So the best way you can see these muscles, patient turns supine, hip is slightly flexed and abducted.
Okay.
Mild problem, mild. And then
and you
she
feel like it's easier when the hip is flexed.
right. So
Because
look
when
at her
it's
like
too flexed, that's definitely, I think.
I
it's
don't know, you
fine.
guys can see it. My model's leg is like this.
I've just had patients with knee flexion contractures and their hips are really flexed and
You
it's
can
hard
have
to
it.
see, so
Yeah.
just a little
Oh,
bit of flexion.
Yeah. So okay, Jeremy, start from the top to bottom again.
Okay. Come
So
back up.
when you look for the iliopsoas, you have to go
Very
down and slightly medially, keep moving medially until you see the femoral head, and then identify the femoral artery. Okay, ready? Go.
Yep. Alright. So we're at
ASIS.
ASIS, so we're going to go inferiorly and medially on the.
Oh my goodness,
Oh,
how
yeah.
they going to share the screen? Okay.
Uh,
AIIS
yeah.
now, stay there.
Now we're at AIS.
AIIS.
I'm going to come a little more medially.
And then,
Here's our femoral artery to the right of the
Uh-huh.
screen, so that's going to be our home base.
but you have to look for the femoral head. See popping out here?
Yeah.
So my, last time we had the same problem with the, we have to show like this, right? And then artery nerve, very clear, and then there's point here, so. This is the nerve, this is the artery. Iliacus, but iliopsoas is here in the corner, but my pins, psoas is this one.
Yeah.
You can see
So
psoas.
this was
So,
Yeah, iliacus. And then you don't know where is rectus femoris yet, right? But it looks like this one, but you're not so sure. You scan down, this part is getting bigger, right?
right.
Yeah.
So that's why you get to know. And then between the sartorius
Yeah.
and specialata, there is a copy here. This must be the lateral femoral cutaneous nerve. As you come down, then moves up to sartorius. Here, about 2 to 3 branches you guys can see.
Oh, yeah.
Yeah. Okay, so
So basically, when we are right above the femoral head, that's when we can see lateral femoral cutaneous nerve and between sartorius and
Specialata.
and then it goes on top of sartorius, right?
go up to the sartorius. Okay,
Okay, one more time for fans back home.
now you explain well.
Alright, so starting from the top, ASIS.
Since
like
we are
felt
sharing the screen with other
palpation.
people, please put more gel.
Yes. Alright. ASIS, that's based on
Okay, your home
patient's
base.
anatomy, so then we're gonna go inferior medially as we slide
Right
along
now,
the
show
ilium.
me AIIS.
So now we're
So here, stay here.
coming near
This is
AIS.
the AIIS, right?
Yep,
And then rectus femoris tendon start from here, insertion,
Yeah.
and then go down
I'm gonna go down
Medially,
inferior
you
medially
see?
as well to get
the femoral head.
what the femoral artery is view.
Yeah, this is the artery, and
Yeah.
this is psoas. You guys can see psoas very. So this, like
Yeah.
today's model, shows this way, but everybody looks different, right? But you have to know the relation between muscles
Yeah.
and artery and nerve to identify the target muscle. They look same and different, similar and different.
Not
And then if
Okay.
your patient usually is gonna have a hip flexion contractions like this, and it's very hard to know,
So that-
right?
yeah.
So you have to press down and always make sure with the femoral artery. So lateral to the femoral artery, medial to the rectus femoris, underneath of the sartorius,
Sartorius,
above
yeah.
the femoral head. That's
Yeah.
iliopsoas. You're coming this way.
Yeah.
And specifically, that's the iliacus muscle, the
Uh-huh.
psoas tendon
Mm-hmm.
coming into view at the inferior to the
Yeah.
iliacus muscle.
So now I'm gonna ask Heidi to
Here's
do
our
it
triangle
before
to
we
see
change
everything
the
in one
yeah.
view with the artery out.
Mm-hmm.
Iliacus on the right, sartorius on top, TFL on the left. and
So
then-
I said our sartorius looks like reverse triangle, but Vera sartorius a little like oval shape. But most of patients is reverse triangle.
That's the iliacus
This
right in the middle of the
is-
screen. With sartorius right
This
above
is
it.
iliacus.
Yes.
This is sartorius.
And then left,
This is psoas. Psoas is here
Okay.
in the corner medial
Yeah.
side.
and then
And
the
then
left
specialata,
yeah, and left and
lateral
cutaneous
femoral
nerve.
cutaneous nerve.
And then rectus femoris, there it is, coming into view.
So rectus femoris is getting bigger, right? As
Yeah.
the
Right up
scan
here.
down,
Yeah,
but the
now-
iliopsoas is disappearing. So for you to differentiate rectus femoris and iliopsoas, you have to scan up and down.
Yeah. So now it's kind of everything into view, and now you can see iliopsoas disappearing, and rectus femoris becoming bigger in the middle of the screen. The
Very good.
sartorius that's now on the left, and
And
iliacus
then
is on the right.
sartorius immediately decoshate right after they leave the inguinal ligament. So it switches the side.
Yeah, it goes with the-
You can scan down to see how sartorius is moving. See, it's going to the medial side, right? It was lateral side, but now it's medial side. The reason why we have to know rectus femoris because when you scan down, you don't know which one is the sartorius and rectus femoris actually. It's hard to know.
Okay.
Okay, very
Alright.
good.
Good. That's
And,
more laterally. Okay.
Okay, now then hide the practice and the people we go downstairs. And then when I do the leg, we can change the model.
We check the chat. Oh, I think the
Yeah.
chat is the
Try to
I'm
put-
checking the chat. What I'm trying to figure out is.
Can you
how to
send?
have
Oh, there-
notification.
Heidi Chen, hello.
So we don't have to just.
That's
be
me.
Oh yeah, so it's
staring at-
coming up.
It's coming.
It
I'm
comes
just-
up, but it doesn't notify.
I'm just trying to
So
get a
it-
notification so we don't have to stare at it the whole time.
Okay.
You know, so
Yeah,
it
yeah.
like makes a sound when it
Yeah.
comes up or something.
Okay. Got it.
So two people is only us, right?
No, there's somebody else. One is me and there's one other person.
Okay, Heidi.
Oh, sorry.
No, she got off.
Wait. Let me,
It's cold.
You know what we can do?
What's
Should we try to see if
so now you're good.
did we figure it out? We should have the other.
Too much
Yeah.
It works. Both five
Okay.
minutes.
So that's
Some-
A-I.
And,
Yes.
yeah.
Because her case
Oh, wait,
is
yeah.
really,
Yeah.
Okay.
that's AIS.
Yeah, that's
Yeah,
area.
so we can see in the middle, the beginning of rectus
Now once you
femoris
go
is
down,
the
media, you have to go a little
Medial,
medially.
medial, anything?
You're doing better.
Now
See, you're
we have
clearly
Because
showing
the artery.
nerve, and then
femoral
the
artery,
iliacus muscle and soleus muscle.
nerve, and the AIS, right? AIS.
Try talking.
And then scan down, but slightly medially move, so you can see the rectus femoris tendon here.
Right.
And then as soon as you see the AIS, on the top of AIS is the tendon, but also everything is iliacus.
Right.
This is all iliacus, yeah.
And then if you
And
go
so
a little bit smaller.
Yeah,
Psoas is sitting here, right? Psoas was there. You
Yeah.
remember? Go up a little bit, AIS. See, AIS is all iliacus, but there's psoas you can see it here, right?
Okay.
Medially.
Yeah.
And scan down until you see the femoral head. Femoral head, cartilage in the dark. Is the cartilage, right? And then you can scan down a little more. More. Rectus femoris started popping out now, right?
On the left side.
Yeah. Very good. And then now at this point, the sartorius is changing the position to the medial side. Coming down.
Sorry.
Uh,
And then if we go a little bit more laterally, then we can also show the
going on.
tensor fascial lateral. Yeah.
So now you can go back to ASIS and then pay attention to tensor fascial lateral. So sartorius, so now you must be lower because it's
Too low there,
depositing.
So now we
Here.
can see tensor fascial lateral on the left side of the screen.
So you have to
No.
go up more.
Right
Go
side.
up more.
Here.
Or more. Here. ASIS.
It says all in the right.
Oh, I didn't mean to do that. So weird. Very easy. This is the tensor fascial lateral. Tensor fascial lateral here.
Yeah.
I was sorry.
This is the sartorius.
Yeah.
So so easy. See, very clear. Better.
Okay.
I think you
Dig
have to-
in and angle.
Yeah.
Okay.
Angle. The waiting.
Great. Okay, so
Yeah.
TFL.
And the gluteus medius. So when you do gluteus medius, a lot of the time you get to do gluteus medius. Because a lot of the children with the spastic cord is a frog-leg position, and we are having hard time to close their leg. And then you go to the follow the iliac bone, and about 1/3 from the ASIS follow the iliac bone, and 1/3 along the rim of the iliac, and the 1 centimeter below. That's the motor cone area. So you can scan down. You
Wait,
can just do injection.
1/3 to sacrum
ASIS
or
come down
1/3
over
to
1/3 whole iliac bone, right? So from the
right.
ASIS,
Uh-huh.
1/3.
And centimeter down.
Yeah, 1 finger to press down.
1 finger down.
then you don't touch the gluteus max. Only
Makes
medial
sense,
sitting
yeah.
there. Okay, done. And then we go downstairs.
I don't know anything downstairs. I have nothing here, guys.
Now you guys gonna show me.
I can do lower part because I can.
Yeah, we can do. You guys are comfortable here, right?
This part, yeah, this you can do.
Whatever.
Come on.
Or
Oh, 4 people are viewing. What's that?
Where do you
I
go?
got four upstairs.
Still upstairs?
ooh, so white.
There's muscles there.
I'm afraid it's fat.
Oh, there's some stuff cute there, but then there goes muscles. God, I lost all of it.
Okay. They don't.
Storage.
Okay.
Baby storage here.
So here, where's the rectus femoris?
Oh boy. The one on the left.
Where's the rectus
You have
femoris?
all 4 quads.
So you can see the nerve here running around it here.
Yeah.
Go a little more medial.
You have to go more
Yeah,
medially.
that's-
all 4 quads
that's
are
four.
there.
So,
Yeah.
and then where's the
Yeah.
sartorius? Where's sartorius?
There should be already
More
More
medial.
medially, right? Now you have to double check. You wanna go, see there's an artery here. You wanna go over, this must be sartorius. So when you do rectus femoris, it looks easy, but it's not easy. Actually, you have to go back and forth.
Not easy when you're starting in the middle.
Uh,
It's better.
All 4 quads.
Yeah.
okay.
Okay, so you have lateralis
And then
so that right on top of the point should be
there's the very small. Okay.
Does the intermediates come a little later?
So
That's
here,
it.
I think
to
it's
this,
all-
yeah,
it's
Yeah.
just
It's sitting right on
on
the.
the wall.
Yeah.
here.
Sorry.
No,
This one's larger. Super big deal.
good job.
I know. Alright, let's just start down then. Okay. Tendon, we come up superiorly. And
Yeah.
here you have intermedius right on top of the femur, then you have the biceps femoris down. Oh god.
This is the
Rectus
rectus
femoris tendon right on top, superior. So
And
that
then
on
this is the angle?
in the right it's named medial, and then on the left side it's the lateralis. So
This
go
is
this
still
way.
rectus femoris.
There you go.
Yeah, here.
This makes more sense.
Oh, beautiful. Here it looks like a real rectus femoris. So you remember from the to go to pes anterior, we want to meet the gracilis and sartorius in the mid thigh, right? Do you guys remember that?
To go to what?
To be pes anterior, right?
Yeah.
So here,
Or-
sartorius, and then if you scan down, 2 muscles are meeting. More medial. In the mid thigh,
Wait, sartorius, gracilis, and semitendinosus, right?
semitendinosus. So 2 muscles are meeting here. One, and so this was sartorius.
Yeah.
This was so it must be the left side is the lateral side. This is the lateral side of the leg.
Yeah.
This is the medial side of the leg. And then 2 muscles are meeting. And then now let's go scan down.
Alright,
Alright, like
Are you okay?
Have you heard an acronym for the like the nerve innervation?
Nerve innervation? Nerve
I
innervation.
just heard
Teach us.
sergeant fought, like a sergeant in an
Oh,
army
yeah.
fought. So
Mhm.
sergeant SGT semi tendinosus gracilis. Or wait, no, sartorius. Sartorius gracilis semitendinosus is the T.
Uh-huh.
And then fought, it's the same. So F is femoral nerve for sartorius.
Uh-huh.
O is obturator nerve for gracilis. And then T is tibial
Tibial,
for
right.
of the
More
sciatic.
difficult.
I think it's harder than
No, I like that.
Wait, what, like five?
Really?
Like
No,
five-
FOT.
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 Someone
But
mentioned this
you-
one.
you
but
pronounce it
I
as
never
FOT.
remember until someone
But
says
it's
it.
spelled as
Tibial nerve.
FOT.
Okay.
But you say it as
Okay,
FOT. That's
okay.
what you
It's
say.
like a
Yeah.
sergeant
Sounds
fighting
like-
in a war or whatever. I don't know.
I like that though.
When you're
Really?
when you're like hundreds of questions into boards, I need acronyms to help me out because
Clean and simple, I mean, it's
yeah,
one to one.
yeah, exactly.
I found something yesterday.
Oh, if you
I don't know what that was. I forgot it already.
Feels like crap, but I think it should be lower.
We lost 2 viewers.
We lost 2 beers.
One
Yeah, we have 4 viewers.
They didn't like my
No, we have
acronyms.
4.
We had 4.
Really? I thought we have 2.
No, just now we had 4 and it went down to 2. Anyway.
Okay, anyway. We're very sad. Oh, this is the one showing how many viewers.
Exactly.
Oh, my face is too much.
Thank you.
Did you me?
We spent so much
Okay,
time on scanning
now-
the
Did
single
you?
side
Because
one.
I apologized.
We literally spent one morning just doing press answer and.
I know, and then it didn't
It's not
record.
here. Oh, that's what that is.
That's the one that didn't record.
Was that my coding one?
But the 8 second? What?
Remember how we did the whole morning scanning?
Yeah, 8
press
seconds.
answer and then nothing?
We
Eight
had a lot of
seconds.
good views. Yeah.
We had fun,
Oh, that's
but
there.
Yeah, it's them going there.
Yeah, you know, it's coalescing
And then
there.
it's a little bit hard to kind of like, in the very end, it gets harder to pull out. We got it, I think.
that we couldn't videotape, huh? The
Yeah.
test
No,
answer. We
had
had
so many
found
good
all the
views
things.
of it. Yeah, I know.
The thing that we did.
We traced everything out and
Mhm.
didn't record.
We were seriously chasing them
Up
down.
and down, we did 17 analysis up
Oh
from
man,
press
that's
answer.
what near impossible too.
Right, is that Dr. Azizi?
That's it, isn't it?
Yeah.
Is she on it? She's the only one.
You commented.
Dr. Aziz, you cannot leave.
No, now we got
Oh.
4
Thanks,
viewers
Doctor.
back. We got our 4 viewers back.
Okay.
Someone's a
Then,
double Okay.
shall we go to the obturator nerve? Okay.
Yeah,
I've
yes.
never found this. Yes, we're going to
Yes, obturator nerve.
I was here for this.
You're not?
No.
Then
I
you
wasn't
show.
either. I was,
Oh my God! Now really,
I
you
was on
have to
phone
show
for
obturator
90.
nerve.
I,
Yes.
I was
Oh my
probably-
God! Good thing that I'm reviewing now.
you're not covering me at 7
Yeah.
a.m., please.
At some point, I was covering it.
Okay, Ray.
Your
turn.
No, I was on night. I was
Your
I was
fellow
late,
doctor
so-
No.
It's probably
It wasn't-
Okay, Heidi.
I wasn't here because I was probably on nights.
Okay.
on a Sunday night into Monday? No.
I only came that first week because then I was on nights the next 2 weeks.
So when we do the obturator nerve,
Yeah, but no.
Yeah, so I didn't.
when
Okay.
we're like injecting it, I like to start out with landmarks so you at least know where you're feeling it. So we go from the adductor muscle group, so you can feel the adductors right here, and that's where you'll inject.
So
we
adductor
can use that to
motor
start.
point is just below the inguinal ligament, about 1 finger breadth down from the groin. That's the motor point. So I'm gonna change the depth. I'm gonna be technician. Let's go.
Thank you, Dr. Kim.
You're welcome. Okay, now you guys see. So the another one, if you are beginner, you don't. Let's say you don't know adductor longus where that is, and then find out the femoral artery, right?
Sure.
You have a femoral artery here. I'm gonna put the color flow. Femoral artery is this one, right? And then underneath, so is the vein is saphenous vein here. So now I'm going to get rid of that. And then see, that's the vein, saphenous vein. And then cursor. So just, I'm going to bring it down more. Now you are moving your probe to medially. And then you can see, ooh, it's a nerve, it's actually look at the nerve. And then you have to find out the hamburger, right, bun? 3 layers. But see, this is the obturator nerve actually running, you can see.
Oh,
Yeah. So underneath of the femoral artery, usually pectineus. This is the pectineus. And then you go medially. Pectineus here medially. But already grasping this. Princess is a little difficult in general. Here, if you see it, she's looks like she has no brevis. Longus.
Okay, come on, where am I
This
going?
is, you can see artery nerve running here, but this is the gracilis here. Can you go more medially? See gracilis already? So this is magnus. I cannot say which one is brevis here.
And that's kind of my landmark one to like.
Three things.
If I start seeing the soleus, that means you're getting away from the adductors.
So this is the longus. This is the longus. I'm not so sure brevis. Where is the brevis?
But maybe brevis is just lower and then it's magnus.
You have nothing to
It
say.
could
No
be, it's
brevis.
just not that typical like hamburger shape.
No, everybody has hamburger shape.
Apologies.
This is actually not a Polish,
Russian
but it's
hamburger.
very distal.
Yeah, it's, you
Yeah,
know,
clear.
Russian.
Now you can see actually, guys, look
I
at
was too
this.
distal.
He was too
I was
distal,
too
that's why
distal.
you lost the hamburger. So it was a raised
I
fall.
was trying to get
We're gonna
this,
go more
pregnancy.
laterally. So this is the artery, this is the saphenous vein, and then this is the, she has beautiful pectineus here, round. This is the pectineus, and then as I go medially,
Yeah, now.
longus, brevis. See, you can see facial line.
Okay.
Longus versus three hamburger, one here. And if I go medially, this is the gracilis. So if I want to show gracilis better, see now, longus, brevis, this is the gracilis and the magnus, everything is magnus. So if you see obturator nerve, mostly this part. So between the pectineus, longus, between longus brevis is the anterior branch of the obturator nerve, right? If you scan up and down, it moves. This, can you scan up and down? Medially lateral. This obturator nerve is gonna move this way. Move. See, now you see?
Yeah, now.
See?
Mhm.
Maybe you know,
Yeah.
vertically change. Maybe you see how the nerve look like. Here, I think the nerve you can see. Yeah. Right? See? It's moving. Move fast. Move. So when you try to see nerve, you have to scan fast. The scan. See? It's moving. Can you see it?
Mhm.
Up and down. Okay, now I'm going to bring it down. So now posterior branch is between brevis and magnus. And this is the vein. You can see. We're going to go again. And
So
then,
then the obturator nerve, we're gonna do with phenol, right?
yeah.
Like that's what if you want to inject phenol.
Mm.
Because if you want to do water.
So here, so you can see this is the small branch of the anterior, this is the posterior branches. See, it's moving here. Posterior branches. Anterior branch also supplies gracilis, okay? Anterior branch. So anterior branch all together move like this, coming here. So when you put the needle
Surgeon
here,
Ford. Yeah.
see here to what?
Sergeant Fox.
Ah!
That's what I'm talking
Oh
about.
my god! I don't need to remember that one. My head gets burning. If I have to remember all the
No,
things.
wait, you already know that. You don't need to
Here.
remember it again.
Yeah. So, but the funny thing is, to be honest with you guys, when I put the needle, many times you miss. This one, along the facial line, is obturator nerve runs, but more, I get more like a top here, this one is all small branches, motor branches. So you have to move around, you don't just put the needle here without the nerve stimulator. It's very difficult to identify the nerve actually. And then many times between the pectineus and this triangle, I see triangle here, longus brevis, right? And pectineus, like this, triangle.
Mhm.
That's my target area mostly.
And then,
If you sliding,
So you want to get them before the branches anterior and posterior?
see look at this. Yes, sometimes I do.
When
Yeah,
you're
when
doing
you're
that.
doing
Yeah, sometimes if I'm lucky.
Yeah.
But I usually divide. See, this is all the nerve, look at this.
Yeah.
More like a, how do we twist to the probe to like a kind of
Yeah,
slanting.
because it's
If with
it's
the
not
vertical,
straight down.
yeah,
it's
it's
not like the
not-
femoral
See,
nerve.
look at it, look at
It
this.
starts to curve.
Yeah, look at this.
It's
This
not-
is the way you can follow better. Now I know better. Yeah. Okay. Now, so we'll obturator nerve you guys learn.
Yep.
Oh,
And
yeah.
then, so you know you're gonna do it, right?
I can do the lower, I think, because I can.
Can I just check this? Sorry, I just wanted because you can feel the adductor,
Yeah.
and that's where I like to start. Like you feel the adductor muscle right here.
Right next to the
But
tendon.
yeah, okay.
It's higher up, I think.
So actually,
So
for
it's
the
like here,
for the
What's that?
viewers,
Closer, yeah.
when you put the needle, if you wanna do motor point blocks, so this is the
Yeah.
on the top of the longus, right? So
Yeah.
hold that one,
right?
hold like this, hold.
Okay.
And then you directly come, I'm gonna move my cursor. So I'm gonna put the needle like this, straight down from here. So you get to hit actually motor point of the obturator nerve. But if you wanna the nerve block, I am aiming actually here, right? So I'm not coming, my needle is not coming on the top of the longus, above the longus, like how do you say? This is the longus, adductor longus, right? Not on the top of longus, but above the longus. It doesn't make sense. This is the longus, now I say come like this, right? But if I want to do nerve blocks, hold the adductor longus and then I
Try to go
aim.
in between it,
How do you say?
between the longus, the brevis.
Right.
From laterally.
Yeah, I go more like from the laterally
laterally.
and then go
Yeah.
aim to that triangle area.
Yeah.
Not on the top. On the top, you cannot go to the triangle easily. But if you go
Try
on
to
the
go
top of the
between.
adductor longus, you can aim to
In
the
that
triangle.
fascial line.
That's the way I get to find many things. Actually, you can do yours by yourself.
Yeah.
You do many things today by yourself.
I know, right?
So I had a question though. We had a smaller child, and I was trying to palpate the.
Smaller than me.
And this is why I bring it up because it's small. I was trying to palpate the muscle area, but I was too medial, and I was feeling the gracilis. But I guess that's just gonna be a lot more medial. I don't feel gracilis.
Gracilis?
or-
You don't feel gracilis? What was your question?
Just
adductor
to
longus
make
is
sure
the-
I'm feeling the gracilis and the.
So what I do
and
the
the-
adductor longus, and I just go one finger breath and this is
And that's the gracilis.
Yeah.
So I
Yeah.
don't really feel there. I guess
It's a
they
hard-
just had a prominent gracilis. in it for
Because
a while.
adductor longus is a prominent, so I go
I think
below.
it was different because their gracilis was really
Yeah.
sticking out.
Okay, guys. Next.
Jeremy?
Okay, next, the left.
Hi.
What, the adductor? No? The left, lower
Yeah.
left? Or
No,
adductor?
adductor.
Adductor, okay.
Yeah, because I
Thanks,
did
I
not
just-
know you guys missed the
No.
adductor longus. Did we do it?
Because I remember a ton
Honestly-
of.
I didn't answer those.
It was the
Honestly,
day I was coding
remember
somewhere.
that we did it in the endoscope, but I don't remember doing it here, like.
Maybe
somewhere.
somebody is lazy and into something.
Hi,
because
Dr.
two
Kim.
become four become two, back and
Yeah.
forth.
Tendon,
Someone
Maybe
is
they had
trained.
a bad, yeah, exactly.
and then we go a little bit down.
Now explain to people.
Still figuring it out.
Yeah, that's gracilis, right? The wide hyperechoic one.
Alright, they want the front.
So cute.
Right, pectineus right there, the circular thing right in the middle.
How do you
Then
say?
you have adductor, longus, which is probably.
But how do we answer?
Right, right below.
LB, yeah.
L here. Yeah,
E-
and then Magnus is below that, and then between the longus and brevis is the artery.
And then if you go when we do it,
This is
it's
your soleus there.
Gracilis, there you go, yeah.
But if you go more laterally from here, you just see sartorius.
Sartorius and then I guess what's femoral.
Yeah,
This-
that
yeah,
there's
that's
sartorius right there.
Yeah.
Okay, beautiful. Thank you.
Everything's in place.
Yeah, yeah.
We didn't lose any
Okay, now clear, right?
Yeah.
Okay.
Good. Okay.
Now,
Anterior.
oh, we have to pay my princess Vera today. Okay. Now, Vera, you explain to us
So
first.
my medial side will be
So,
left side.
yeah.
Okay?
So left side, oh, you remember the home base. Start from here, right?
Yeah. So now I see tibia.
Tibia.
Right in the middle. Then I drop down laterally from it.
So
So
here,
I
very
can see-
proximal part, we have no extens hallucis longus yet, right? As you come down a little bit, 1/3, according to anatomy book, like a 1/3 EHL start. EHL usually go with the tibialis anterior tibial artery, right? So
Okay. So right now I can see tibialis anterior.
look at this. So this is
now-
this much is gonna be. Look at her probe. Her probe is in the kind of 1/4 between 1/3 of the from the knee, and if you this one is gonna be anterior tibialis, right? And you can see artery, anterior tibial artery.
Artery and
I'm
then
gonna
extensor.
show. This is the anterior tibial artery. On the top of that, actually, there is deep peroneal nerve. Actually, I was watching you guys scanning, and then I was able to see the
Oh, I
deep
see.
peroneal nerve going back and forth.
Yeah.
So look at this. Now I'm gonna get rid of that. So here, you see anterior tibial artery. The nerve is on the top of it. You can see. Actually, from the if you go proximal part, from the peroneal, underneath of the peroneus longus, there is a superficial, and then common peroneal nerve sits there and it splits. If you look at
Yeah,
here,
near the fibula. I can see it.
this one is going to be very fast here. This nerve is coming down to over here.
Mhm.
So, and then the superficial peroneal nerve sits here still. Actually, if you guys look at the previous here, oh, the nerve is coming here now. So above the anterior tibial artery. So then this tibial artery is moving, right? Always extens hallucis longus is going to be above the anterior tibial artery. So anterior tibial artery extens hallucis longus. On the top of that extends digitorum longus. More so. So look at this. Now you are in the middle one third. Here, see, can you see the nerve?
Yeah. We
Here?
can see the nerve. We can see the artery.
Artery.
We can see the interosseous membrane and we can see the.
Now you're gonna
tibialis
stay
posterior
there. Now you're gonna
behind
move
it.
your great toes. See? Great toes. And push against me. And relax. Relax. Now, can you relax and push against me? And relax.
Yeah.
Because she's moving everything. That's why.
Go more. If you can you go a little more.
Here.
You can
Here.
always confirm placement.
Oh my
of
goodness.
skin,
Oh,
too.
this one. Can you
Yes.
see it? Yeah. So
Some hard to
this
tell
is
if
the
it's
area you
not
can
as-
hallucinate.
not
Now
as,
the
like,
great
well
all the toes.
delineated.
See? Relax. Extensor
It's a-
distal longus is
Oh.
here, right? The EHL. Oh,
Yeah,
no, no,
like-
It's like somewhere. over
EHL,
Yeah.
extensor distal longus,
And then
It's
here.
very-
and the
it's not
peroneal
very clear.
nerve is in here. Good. And then scan down continuously. Okay, so here, where's your artery? So anterior tibial artery is actually almost home base for you guys to figure out the
Here it
extensor
is.
hallucis
Got it.
longus.
Here it is.
One more. Here. Right? Even artery. So the deep peroneal, I'm sorry, deep peroneal nerve is very deep. So that's why you guys, we don't see whenever we scan, but now you know that above around the anterior tibial artery, so you can scan down.
If
So,
you're trying to find
I think we have a lot
nerves,
of
you can always
reasons.
look for vasculature.
Yeah,
trapezius.
we have a lot of reason to avoid the anterior tibial artery, right? Because you can hit the deep peroneal nerve too. Mm. Yeah.
So we're gonna go a little bit more medial.
More
if you wanna
medially.
inject that to
So
the
always you
center.
try to avoid the artery changes continuously. That's the real anterior tibial artery. So it used to be in the more close to the
Yeah, it's
here,
really
see, look at
laterally.
this, more laterally. And then as you scan down, it goes to the medial side, medially, right? Medial. Okay.
Okay. Good again, or we're
Oh my
clear?
Oh, I'm sorry. Oh, I'm scared.
No? Okay, we can do medial side.
Okay. Now, medial side.
Yeah, let's do medial side. So mine.
Oh.
Harder.
Oh,
This delayed one. Okay, medial side.
so my left side will be posterior.
Left side of the screen goes the proximal part. Good morning, how are you?
Good, how are you?
Are you a medical student?
Yes.
Welcome to your paradise. It's always your, just to remember the previous one.
Okay.
Yeah. So from the proximal part,
Um,
and then now you can scan down, and then posterior popliteal angle, the artery. Continue. Get rid of the anisotrope. Okay. Now you show me. Good. Now
Okay,
you
so
have
here I have medial gastro in the middle of the screen right now.
so
And then soleus.
cursor.
Yeah.
So this is the medial gastro,
And then this
this
is
is
the
soleus. and
And
then
this
this
is
is
flexor.
gonna be
Flexor
flexor digitorum. Flexor digitorum.
digitorum.
Yeah.
And then
See,
colossus, right?
you are very low part, so here triangle shape. So remember we vertically we moved, we were able to see all toe muscles.
Yeah.
And then from this artery become your guideline. This is a fascial line. This is sometimes I call it chair muscle. Looks like a chair. This is, looks like a sofa, right? And then this is the triangle. But if you come down like this, we follow the muscles vertically. So top here is going to be soleus. It's going to be toe flexor longus, right? And the artery here, sits here. And then move your toes. So here. And then we're going to go back. This is the flexor digitorum longus, soleus. If we go here, gastro pops out, right? Gastro wasn't there. So soleus, FDL, posterior tibialis. So posterior tibialis is going to be below the artery. See, this artery underneath is posterior tibialis. Push against me. This way.
Yeah.
Relax. So here, underneath of the artery, right? Okay.
Alright, so medial gastro, soleus, flexor digitorum, longus, triangle.
Another one here, you guys, you can see
And
two
then
bones.
tibial.
So you see two bones?
Yeah, of course. Yeah,
Right?
we can see
So,
fibula in the back.
hold it here.
Uh-huh.
Hold it here. If you, oh, no, I know, I want to make it one. Let's say, here, this is the tibia, this is the fibula. Between two bones, this, even bathtub muscle you can see from the medial side, right? This is the posterior tibialis. You're in between two muscles. And then here I cannot tell. This one is FDL. This one must be the posterior tibialis together like this. Here. Because we are seeing from the medial side. But posterior side we are clearer than before. Posterior, if you go like this, hold it. There's a lot of here. See, now you see.
So this is biggest soleus and then smaller.
Here you can see. Can you move your big toes? See? You remember? Above the fibular is going to be flexor hallucis longus. The tibial side is going to be flexor digitorum longus.
So this
triangle.
is FDL.
Not with the little part, just the top part. Yeah.
Disconnecting.
Whoa.
So if you look at it, and then it disappeared.
Keep going, I'll make fun.
Posterior. So here, this is the flexor digitorum longus, right? And then here, this is the flexor hallucis longus. Between tibia and fibular, this is the fibular. This is the fibular.
This is the
Yeah.
Yeah.
So if you on prone position is much bigger, but this bathtub is going to be the posterior. This is going to be flexor digitorum longus. This part is going to be flexor hallucis longus, soleus, gastro.
Yep. Find like my popliteus.
Okay.
Last time
Okay.
view.
Yeah, right.
It was like pretty low though.
Which one?
The popliteus?
Yeah.
So it's like here.
You
Okay.
I think you have to in prone position is easier. This
Yeah.
must be public.
Yeah.
This
So
one.
yeah.
This
and
one-
it's gonna disappear.
Coming up the compound, right?
That's
Why it's not on the posterior?
yeah, disappears.
Posterior is oh
Yeah,
here.
this is really
So
pretty
this
close.
is the
Their mind
publicus,
is lower
this
than
one.
the one.
Remember this one
Yeah.
is the publicus. It's disappearing now.
Yeah.
Now then flexor digitorum longus pops out. Go to here, publicus is here at the top.
That's
Oh, already flexor digitorum. There's a lot of crazy. Is pregnancy? A lot of I don't know. Breast is very bigger than.
So the
Mm,
nerves,
I
the
think so,
nerves
yeah,
is
it's
so
a-
big. I
so
can feel,
big, I can feel-
each of the nerves.
I mean,
swear.
when
Like-
I applied to you, I didn't see
Yeah,
this
me
much
too.
bigger
Yeah,
vessels
yeah,
at all.
yeah,
Everything's
tiny.
like pumping. No, theory is coming.
Ask
Pregnancy
your next
vessels.
Also,
time.
now
Next.
flexor digitorum is so like
Flexor,
separate.
yeah.
So
Here.
where do you find flexor hallucis? Because I always get confused with that.
Very low.
That's
Yeah,
that's
that's
it.
it.
Okay. Yeah, that's
Your
it.
gastro is gone here, right? No more gastro.
And then I have my flexor
That's
hallucis
so,
over here.
gastro, soleus. What are you looking for?
Flexor
Flexor.
hallucis.
Flexor hallucis, so you have to go. And then later, decussate coming here, right? All coming to
Yeah.
the posterior
Yeah,
tibialis,
it's so
flexor hallucis,
confusing here,
longus,
the
digitorum longus.
intersection.
You have to follow from here. It's a bit late now. Oh my God, we're looking for blood vessel. Your blood vessel wasn't like this last 2 weeks ago. How many months now?
Everything's
25?
pressing.
Wow.
25 weeks?
22.
Or 22? Wow, we should do a study. Blood vessel during pregnancy.
Compare my leg right now.
Yeah.
No, seriously.
Compare.
Side by side.
Yeah.
Do the measure the cross sectional area. You know how to do that.
And Doppler.
Yeah.
Sound of the blood vessel.
Yeah,
Okay. What was it?
Yeah.
Much healthier. Thicker. Thicker. You don't provide your blood to other person.
Yeah,
Your
Very tiny.
flexor, look at your
My-
flexor
I know.
digitorum and my flexor digitorum.
This is why my toe yoga sucks.
This is why my belly rules.
Oh god.
So here you see gastrosoleus
Yeah.
Yeah.
and the flexor digitorum longus very small.
Yeah, and it gets a little bigger.
And bigger.
tibialis.
And then posterior tibialis what? Yeah, who's
Oh, it
this?
sounds like
Who's the first case?
Yeah.
Oh,
my
and
blood
Adi?
look tiny.
Oh.
Yeah.
Tiny.
Let's do your foot
I know.
analysis one.
Shouldn't say the names on YouTube.
We can say bye.
Yeah.
Alright.
It's
All
already 8
right,
o'clock.
this
Yeah,
has been
40.
the
Yeah.
2020-2021 academic year.
Yeah.
Please give us a like and subscribe. We'll be starting off next year.
Okay, I think I have to
which is in a
picture of
week.
you guys.
Hope to
Yeah.
see you all
Today
again.
is the last day of the year.
Alright, bye.
Okay.
Peace.
We're gonna have newcomers. See you next Monday.
What
Next
is this
Monday, I'm not
one?
so sure. Next Monday I won't be here.
All right, in 2 weeks.
Oh,
In 2 weeks, see you in 2 weeks.
this is really
But we
gross.
have to summarize. So I don't know how I